Hi everyone, welcome to week number 10. This week is what we're really going to focus on is quality control and quality assurance. So that's going to deal with chapter 6, pages 129 through 132, and chapter 44. So let's get started. Let's start with chapter 6. So this chapter is really dealing with quality medical care and how you as a medical assistant will give that quality care. So it's an expectation for all patients to receive quality care, but it also requires that the healthcare team produce procedures and do techniques that result in the best possible outcome for that patient. So that's really done through a program that we call a quality assurance program. This is a system that's going to consist of reviewing records maintained by the staff, along with some other basic components. It's going to deal with establishing a quality assurance committee. It's going to review all clinical and administrative skills and their procedures and services they offer. It's going to quantify all the issues. So for example, what I mean by that are the average wait times to see the doctor, the number of errors that happen in patient records, the number of insurance claims that get denied, and the number of blood draws that fail or no blood is obtained. Okay. The program is also going to limit that number of issues. It's going to try to diminish those numbers so they aren't a problem anymore. And they're going to maintain careful records. They want to make sure that everything is up to date, as precise as possible, so that the best care for that patient can be received for them. So your role in this quality assurance program is really going to be as trained and as up to date in your training in both clinical and administrative skills, and performing those to the highest level. The reason being is that patient satisfaction, is really a key element to giving quality care. Alright, moving on to chapter 44. So this chapter really is going to focus on the difference between a quality control and a quality assurance. Okay? Quality assurance is really a process of gathering information and evaluating that information before services get provided, and comparing them to the information that is accepted as a standard or a benchmark. So it's going to come in three parts. It's going to come in a pre-analytical, an analytical, and a post-analytical. So pre-analytical is going to happen before a test gets run. Analytical is going to happen while the test is being run. And post-analytical happens on the follow-up after the test has been performed. Quality control really falls underneath quality assurance in the analytical phase. Okay? This is really going to focus on providing physical proof that your test results are accurate. Quality control happens in three stages, or three ways. It can be a qualitative, a quantitative, or a semi-quantitative. So how you know the difference is a qualitative is something that's going to actually give you a positive or negative. Okay, that's the quality part of it. And it's going to be used with controls. Those controls are going to be positive and negative controls. Okay. Quantitative, on the other hand, is going to give us a numerical number. It's going to give us a range that is acceptable. Again, this is going to be determined with a with a control, which is either going to be a normal or an abnormal range. And a semi-quantitative is really where we're going to use a test strip, and that test strip is going to have a chemical analyte on it that will tell us whether that is present or absent. Okay? Don't get super hung up on trying to figure out which one's which, because this week in lab we will be actually playing with those and learning the three different styles. So as long as you know qualitative is positive, negative, quantitative is numbers, semi-quantitative deals with a test strip and a chemical analyte. Alright ladies, that's really all I have for you this week. I really hope that you will read your chapters before you come to class. There's a lot of extra information in there about the different types of labs and the CLIA, and learning all about that, but these are all things that we've talked about before, so I don't want to spend a lot of time on the video talking about those things. Like I said, this week in lab, we're going to be working with those 3 types of quality controls and really getting you to understand the difference and what we use to figure out those different types. So we're going to be doing those on some machines and some test kits that you'll get to use a lot next quarter. So you'll kind of get to see how some of the equipment works and kind of get your feet wet and ready for next quarter. We're also going to be practicing your vital signs again this week just to make sure that you guys are feeling very comfortable with that. So please make sure that you have all of the equipment that you will need this week. Also this week you have your 3rd and final quiz, and this is going to be over personal safety. So like we've done in the past, we will do a quiz review prior to you actually having to submit that. So we'll do that on Wednesday, and then your actual quiz will be due on Sunday. Your one discussion post this week is really based on medical procedures and biohazardous materials. So what I mean by that is you're going to have to research a diagnostic procedure, okay? Something like a pap smear or a biopsy or a mole removal, okay? Anything like that. The diagnostic procedure should really have something that's going to contain a biohazardous material. Blood, urine, feces, anything like that, okay? What your post is really asking you to do is to describe the procedure and how you would properly dispose of the biohazardous materials that were used during the procedure and how you clean up the area, okay? If there's any follow-up that needs to happen after that biohazardous material has been cleaned, you should also really discuss that, which is a nice kind of leeway into what your written assignment is about this week. So it's pretty much based on the same concept, okay? You're going to look at the rules of disposal and disinfection. So again, you're going to want to research or identify a biohazardous source and explore how that item should be properly cleaned up and disposed of. Your paper really should be about 2 to 3 pages in length, okay? It's really important, because you're also going to include all the researched rules that you found for disposal and disinfection of the area and where the procedure, so not only the area, but the area where it took place, where the procedure took place. You also need to identify a local service that would be contracted to pick up those biohazardous materials. For example, Stericycle is one that we have contracted with here at Rasmussen to help clean up all of our biohazardous materials. Your job will be to research that local service and discuss in your paper how they pick up the material and what they do with it after it is in their hands, okay? All right, ladies, if you have any questions for me, please make sure that you bring them to class this week, and I will try my best to answer them so there's no confusion. Hope you all have a wonderful week, and I will see you on Wednesday. Bye.